Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So yesterday I gave few practice questions from Integumentary System for you to solve, and few of you actually did and commented your answer. So I appreciate that. And in today's video, I am going to review all the questions and I will explain the concept and the coding guideline with respect to each question. Okay. So please do watch video till end, and if you find it useful, please do subscribe to my channel and please do share with your medical coding friends. So let's begin. So first question was regarding excision. So now let's understand what is excision and what are the CPT coding guidelines associated with excision concept. So excision is a full thickness surgical removal of skin lesion, including removal of margins. Okay, so including removal of margin. What is margin then? So margin refers to normal tissue around the lesion. So whatever the abnormal lesion they are going to excise, around that abnormal lesion, they may take little extra skin. Okay, that will be considered as margin. So next, it involves cutting through dermis and often with a simple closure. So usually after excision, they may close utilizing simple layered closure, and local anesthesia will be used. So then, how the CPT codes are categorized under excision? So CPT codes are classified based on skin type of, lesion. What kind of skin lesion they are excising? Is it a benign or is it a malignant? So that we need to check. Sometime provider may directly mention they are going to excise the benign lesion, or maybe they are going to excise malignant lesion. Okay, or they have excised benign lesion, excised malignant lesion, they'll clearly mention. But what if they did not say whether it's a benign skin type or a malignant? Then you should know few examples. Okay, so what is benign? As you know, it's a non-cancerous skin growth, and example include neoplasm, fibrous cysts, and congenital. Okay, and also inflammatory lesions. Okay, cystic lesions, unspecified lesion also considered as benign. Okay, so these are few examples for benign skin lesion, and we do have codes. CPT code range starts from 11400 to 11446. And coming to malignant refers to it's a cancerous, and it will invade deeper tissues. Okay, it will easily spread. Next example include melanoma and carcinoma. Okay, if they are mentioning like basal cell carcinoma, squamous cell carcinoma, adenocarcinoma, melanoma, all this comes under malignant lesion. Okay, so malignant lesion CPT code ranges between 11600 to 11646. Okay, this is the overview about excision. So now you know under excision you have to look for what kind of skin lesion it is. It's a benign or a malignant. After that, what are the coding points we should check? Okay, so next is size of the excised area. We have to check the excised area. It's not only like the lesion diameter. Instead, we have to look for total excised area. So for that, how to measure a lesion centimeter? That is very important. Okay, so we have to first check the lesion diameter. That means that abnormal lesion diameter we have to check. Following that, the margins on both sides. Okay, because they will be excising the margin also. So margin we have to take it for two side, and then together we will be having total excised diameter. So for example, you can see the lesion centimeter is 1. The diameter of the lesion is 1 centimeter, and the margin is 2 centimeter on each side. Each side, that means into 2. Okay, so like the two side we have to take. So if you check 1 centimeter plus 2 centimeter, this is for margin, and this is an accurate abnormal lesion diameter. Together, you are getting 5 centimeter as an excised diameter. Okay, so you have to check the lesion diameter and the margin. And margin, you can take it for two side, so that the total, whatever you will get, that will be your final excised area. Okay, and with this we need to check also the anatomical site. So let's also see one coding guideline here. With the excision, simple closure is included in excision. So if they perform excision and then closed that excision area with a simple closure, means you have to code only for excision, because simple closure is already included in the procedure. But if they perform intermediate or complex closure, then we need to code them separately. Okay, excision one code you have to report, and intermediate or complex, whatever they'll perform, that needs to be coded with the repair code and utilizing appropriate modifier. Okay, that is the coding guideline we have for excision. So the measuring of the total excised area is very important. So remember this and apply whenever you get a excision concept, and you will be able to get the answer. So now we'll check the question and we'll also find the answer. So the question says 46-year-old female had a previous biopsy that indicated positive malignant margins. Okay, so it's clear they are talking about malignant skin lesion. And then anteriorly on the right side of her neck. So neck is a location. 0.5 centimeter margin was drawn out of, and the blade scalpel was used for full excision of 8 centimeter lesion. Layered closure was performed after the removal. The specimen was sent to permanent histopathologic examination. What are the CPT codes for this procedure? So the total, firstly, lesion, excision of lesion is 8 centimeter and margin is around 0.5 centimeter. Okay, so 8 centimeter is a lesion, 0.5, you have to take it twice, 0.5, 0.5, 1 centimeter you will get. Okay, so together you will get 9 centimeter. Okay, together you will get 9 centimeter of excised diameter. And you know the lesion is malignant and the anatomical site is neck. Okay, so let's check the codes and we will check the options also. So they have given 11626 with all the options. So let's see what is 11626. So you can see here codes. We have benign lesion codes, and here is a measuring. And then in our question, they are said it's a malignant lesion. So under malignant, you have to check. So the first thing is 11626, excise diameter over 4 centimeter. What will it is the location? The location is excision of malignant lesion including margin, scalp, neck, hands, feet, genitalia, excise diameter over 0.5 or less. Okay, so this is the standalone code and these are the intended codes. So coming to 00626, it says excise diameter over 4 centimeter. Okay, so for the neck location, since we have 9 centimeter of the excised area, it should be 11626. Okay, 11626 is the CPT, which is correct, but it is there in all the options. So now how to eliminate? So once you can read the question once again. So they have closed. See, layered closure was performed. Okay, it is not a non-layered closure, it's a layered closure. Layered closure is nothing but intermediate repair they have performed. Okay, along with the excision, they performed intermediate repair. So that apply this coding guideline. If they use intermediate repair or a complex repair, then that must be coded separately. Okay, and as they did not perform simple closure, you can ignore this. They have performed intermediate, then you should know you have to code it separately. So option A you can eliminate, option D you can eliminate, and option B also you can eliminate. Why? Because this refers to complex repair, this refers to simple repair, and the only option left is option C 11626 12044 with 51 modifier. So just check what is 12044 also. So for you will get a better clarity. So 12044 is an intermediate repair for the neck region. Okay. So we'll see that. So simple repair and intermediate repair is here. 12044 7.6 centimeter to 12.5 centimeter. And what are the anatomical site it includes? It includes neck. Okay, neck. We have 9 centimeter. So we are getting in this length range. So 12044 is the correct code. Okay, so the final answer is option C. So many of you gave answer C. So you are all correct. Option C is correct. Okay. And also, 51 modifier is for multiple procedure. Since they are performing two different procedure, you have to utilize 51 modifier. So next question is regarding debridement. So for this debridement, we will see what is debridement and what are the coding guidelines we have. So the debridement is the removal of dead and damaged infected tissue from the wound to improve the healing potential. It may be performed for infections, wound, and chronic ulcers. Okay, so this particular procedure they are going to perform to remove the dead and damaged or infected tissue, okay, to improve the healing. So now, what are the coding points we have? We have, we need to check the depth of tissue being removed and the surface area of the wound. Okay, so now let's just discuss about wound debridement. Okay, wound debridement, we will just check. We do have other debridement procedures. Since my question is regarding wound debridement, I will just check the coding guidelines for wound debridement. Okay. So firstly, depth of the tissue removed, surface area of the wound, we have to check. And coming to coding tips, the coding guideline says, so you can see here. So for wound debridement, there is a coding guideline. So the coding guideline says when performing the debridement of the single wound, report the depth using the deepest level of tissue removed. In the multiple wounds, sum the surface area, those wounds are at the same depth, but do not combine the sum from the different depth. So the meaning they are stating that, so whenever they are performing a single wound debridement, if they are performing a portion up to subcutaneous and a portion of the same site up to bone level, in this case, bone is the deepest, so you will only code for bone level. Okay, but if they are performing multiple wound debridement, in that time, what we have to do, if that multiple wounds depth are same or different, you have to check. That means if it is up to one wound is up to subcutaneous tissue and another wound is also up to subcutaneous tissue, then you can add the square centimeter, that area you can add, surface area you can add, and you can give only one code. Okay, so example, see, the deepest, first one is for single wound, we will code the deepest level of tissue being removed. For multiple wounds, combine the surface area only if the depth is same. and do not mix the depth when calculating for total area. So see this question. Okay, and here are the codes we have for the wound debridement. So now the question says 30-year-old female is having 15 square centimeter of debridement performed on an infected ulcer with the scar on the right foot using a sharp dissection. The ulcer was debrided all the way to down the bone to foot, and it goes on after. So you can read the question. So it is clearly up to bone. Okay, they have debrided up to bone. So it's a wound debridement, and they performed up to bone. They are removed from the bone level. So for bone level, we need to assign the code. So we have the code set. So one by one, I'll explain. 11042 is for subcutaneous tissue, and surface area is first 20 square centimeter, and the add-on code says each additional 20 square centimeter. And 11043, debridement of muscle, first 20 square centimeter, 46 is additional square centimeter. And 11044, debridement of bone, okay, first 20 square centimeter, and add-on code says each additional 20 square centimeter. So in our question, it is a single wound and it is performed to the deepest level, that is up to bone. So for that bone, answer should be, you can just see 11044. 11044 is the answer, debridement up to bone level. Okay, and how much square centimeter is there? It is 15 square centimeter. So single primary code is enough. So answer is C once again. 11044 is correct. Okay, so here it is on foot, right foot. Okay, but assume the patient is coming for multiple wound debridement. In that time, on this right foot, they are performing up to subcutaneous level. Maybe for 15 square centimeter, they are performing on right foot, and on left foot also they are performing around 20 square centimeter the surface area, but the depth is up to subcutaneous. So both location is up to subcutaneous, and the surface area they have covered, one is for 15 square centimeter, one is for 20 square centimeter. Together you can add the square centimeter. That means you can add the surface area and you can give only one code. Okay, because the depth is same, depth is subcutaneous only. So together you will get 35 square centimeter. For that you will use 11042 and additional code 11045. Simple. Okay, so that's how you will calculate. If it is in a different depth, one location is at subcutaneous, one location is at muscle, and both wound debrided at the same session, then as depth is different, we cannot add the surface area together. Instead, we have to code them separately. Okay, so this is a coding guideline applicable in debridement procedure. So next coming to repair. So in the repair, we have three types. As you know, we have simple repair, intermediate repair, complex repair. Simple repair refers to superficial closure, which includes epidermis, dermis, and subcutaneous tissue. And here it includes suture, staples, tissue adhesive, or non-layered closure. Okay, non-layered. And then coming to intermediate, a layered closure of one or more deeper layer, that refers to subcutaneous tissue. I mean layered closure here. Intermediate refers to layered closure. It involves deeper subcutaneous and also it requires maybe just keywords. If I want to say, in the intermediate repair there will be a foreign body. Okay, so I'll just explain from here book, it will be good. So under repair we have three types of repair. Okay, so firstly you can see simple repair. Simple repair code set we have. So each repair you need to check the anatomical grouping. Okay, how many grouping we have, that you need to check. And also what are the coding guidelines applicable, that we need to check. So if you see here, sum of the length of the repair of each group of anatomic site. This is one coding guideline which applicable for all the three repair. But before that, how to differentiate between all these three repair? How we should know that is a simple repair or a complicative or an intermediate? How we should know? So for that you should know this. Simple repair includes. So if I just in a general word I will mention. Okay, it's like it's not a complicative injury or a wound. So here it will be single layered closure is enough. Okay, single layer closure is enough. And also coming to intermediate, in the intermediate repair, what will happen, they have to use the double layer suture. Okay, and also layered is mentioned, means you can consider as intermediate repair. So in the previous question also I mentioned, okay, excision closed with a layered closure. So that time I took it as an intermediate repair. So that keyword is important. So if they say layered closure, then consider it's an intermediate repair. And also contamination. So contamination is here, they'll mention heavily contaminated. So heavily contaminated means it's again refers to intermediate repair. And if any foreign bodies being removed, then also it will refers to intermediate repair. Okay, so next, complex repair. In the complex repair you can see it refers to exposure of bone, cartilage, tendon, and wound, like debridement of wound edges, traumatic laceration, avulsion, extensing, undermining. All these are example for complex repair. So here in complex repair, it requires multi-layer closure. And also, if I mention anything related to reconstructive procedure, then you can consider it's a complex procedure. Okay, so all of these repair have the certain sets. Okay, now you can just see one by one. So the simple repair has how many grouping? 1, 2, 0, 1, 1 is one anatomical grouping, which includes simple repair, superficial wound, neck, axilla, genitalia, trunk and extremity. And here we have to check that laceration or the suture length. Okay, the length we need to check. According to the length, code will vary. And under simple repair, we have two anatomical sites. Okay, not two anatomical sites. Sorry, no, two anatomical groupings. We have two groupings. So you have to check in which grouping your anatomical site is present. According to that, below to that, you have to check the length and you have to take the code. So now let's come to this coding guideline. The coding guideline says sum of the length of the repair each anatomical site or a group. The meaning of that, say for example, patient comes with a multiple laceration and patient is having 1 centimeter on scalp laceration and 1 centimeter on neck. Okay, so these scalp and neck falling in the same grouping. In this case, what we have to do, we can add the centimeter. I will take 1 centimeter from scalp, 1 centimeter from neck. I will get 2 centimeter. So for that, I will use only one code. 12001 is enough because it says 2.5 centimeter or less. Okay, so that is what sum of the length repair which falls in a same grouping. But what if it falls in a different grouping? 1 centimeter of scalp requires simple repair and 1 centimeter laceration on face requires simple repair. So both are in the different grouping. Then I have to code them separately. I have to code two codes. I cannot add the centimeter here. Okay, this guideline applicable for all the repair. Okay, so just identify how many anatomical grouping are there, and according to that apply the coding guideline. So now with this, you should also know this very important thing, closing material. Okay, wound closing material. Few materials are codable and few materials are non-codable. So if you don't know this concept, you may end up getting a wrong answer. So let's read this question and we'll analyze. Okay, so see, the question says 64-year-old female who has a multiple sclerosis fell from the walker and landed on the glass table. She lacerated her forehead, cheek, and chin, and the total length of these laceration is 6 centimeter. Okay, cheek, chin, and forehead. So totally 6 centimeter. And the right arm and leg has a deep cut measuring 5 centimeter on each extremity. That means it is around 10 centimeter. And right hand, right foot had a total 3 centimeter laceration. So now it's a multiple laceration or multiple injury visit. In this, now you need to identify how many repair being done and what are the anatomical sites. Okay, what is the length of the suturing, that we need to check. Okay, and now the closing material. So if you look at it, so they have closed the forehead, cheek, chin had debridement and cleaning of the glass debris with a laceration being closed with one layer closure. Okay, one layer closure is done, and then arm and leg were repaired by a layered closure. The hand and foot were closed with the adhesive strip. Okay, remaining everything they have closed with the suture. Suture is a codable material. But now, lastly, if you are referring this one, hand and foot were closed with adhesive strips. Select the appropriate procedure code for the visit. So now the question is about adhesive strip. Okay, so whenever they use adhesive strip as a solo material, okay, they are not using any combination. Either they should use adhesive strip plus suture. Okay, but suture is not there. Only adhesive strip they have used to close the wound, means that should be a part of ENM. We cannot code the repair code for that. Okay, that's what is mentioned in the book also. Okay, if they use utilizing adhesive strip as a solo material are included in appropriate ENM code. Okay, so now as now you know the coding guideline. So for this, you cannot hand and foot, you cannot code any CPT code. You can ignore this. Okay, because it isn't included in ENM. Remaining whatever the location we have, site, for the site we will check the centimeter and accordingly we have to code it. Okay, and now identify what kind of repair it is. So you already know by now, you should be knowing this. This is a intermediate repair. Okay, because there is a cleansing and cleansing of glass debris, and also they are talking about layer. Okay, layer closure. So the meaning of this, it refers to intermediate repair. Under intermediate repair, check for the location and take the codes accordingly. So easily you can eliminate first option, because you know this is simple repair codes and you know simple repair is not even being performed here. Option B also incorrect. Option C also incorrect. And option D, you can check 12053 and 12034 with the 59 modifier. Option D is correct. Okay. And this one, if you see 110421 thinking that cheek, chin had debridement and cleaning of the glass debris. So this debridement and cleaning, this include cleansing. Okay, the cleansing is a part of intermediate repair. Okay, cleansing is a part of intermediate repair, so that you don't have to code for debridement separately here. Okay, they did not actually perform an extensive debridement. They're just saying had a debridement and cleaning. So you just have to refer to option D, 12053 and 12034. So let's see that codes. Under intermediate repair, we have two codes. One is 12056. Okay, you can see 56 you are coding not 56, 12053. 53 here it is. 5.1 centimeter to 7.5 centimeter. It includes face, ear, eyelid, nose, lips. Okay, all of these part is refers to 12053. So 12053, you can see now what are the things they have utilized here. Forehead, cheek, chin. Total length of these was 6 centimeter. So 6 centimeter means you should be getting here between 5.1 to 7.5 centimeter. So 12053 is correct code. Okay. So next, coming back to the arm and leg. Okay. So arm and leg were repaired by layered closure. Okay. So arm and leg for about how much centimeter we have to check. Arm and leg had a deep cuts measuring 5 centimeter on each extremity. On each 5 centimeter means together 10. So for 10, you have to get 12034, 7.6 centimeter to 12.5 centimeter. The anatomical sites refers to arm and leg. Okay, so in this code 12031 grouping, it contains repair of intermediate wound of scalp, axilla, trunk, or extremities. Okay, excluding hands and feet. So we should not take hands and feet in this grouping. Other than hands and feet, like arm, leg, this comes under extremity. So you have to code under these codes. So 12031, and since we have a 10 centimeter totaling the wound, I will code 12034 as my code. Okay, here you should also remember this guideline. I am adding the centimeter because both the location falls in the same grouping. Arm and leg falls in the same 12031 grouping. So I am adding the centimeter and I am coding one single code for 10 centimeter. 12034 is correct. So that answer is D. Okay, not A, not B, not C. On correct answer is D. Okay, ENM code they have given because we have hand and foot were closed with adhesive strip. This is a part of ENM, so that we have this ENM codes. But here, other than ENM codes, you should know how to apply the guideline and how to get the answer. Okay, so that if in this concept, if you know how to differentiate between the repair and how to identify the repair type and closing material, okay, you will get the correct answer. So once again, I'm repeating my answer. It's option D. Okay, so go back and check if you have got a wrong answer. Once again, you can check and refer the guidelines we have for closing material. Okay, so and also if they closed only with the steri strips, okay, then also it is a part of ENM and you cannot code it separately. Okay, if combination if they use, steri-strips plus suture if they use, then you can code from repair codes. Okay, so that's all. Thank you for watching. Okay, thank you for answering the previous, in previous video, if you have given your answer, thank you for that. I hope I made it clear on all these concept regarding question. We will be having too much to explain, but I have kept simple, and I have focused on only question. Okay, it's like rational. So that's all. Thank you. Thank you for watching. Next, I'll try to come up with other chapter.